They say scars tell stories, but let's be honest, sometimes you just wish you could edit that story a little bit. If you've ever looked at a scar and thought, I wish that was less noticeable, you are definitely not alone. Today, we're going to dive into the science and the art behind what's called scar revision, the actual process of turning a really obvious scar into a much fainter memory. Yeah, it's a feeling that pretty much everyone can relate to. Maybe it's from an old injury, a surgery you had years ago, or even from bad acne. So many of us have a scar that we just wish we could soften up a bit. And the good news? Modern medicine has an entire field dedicated to doing exactly that. So, what do we actually call this process? The official term is scar revision, but don't let the name fool you. It's not just one single procedure. It's really more like a whole strategy, a plan to improve how a scar looks, how it feels, or even how it functions if it's causing some tightness and restricting your movement. Okay, so let's get into it. When does a scar cross that line from just being a mark on your skin to being a real problem? Because not every scar is a candidate for revision. Let's dig into the specific things that make someone say, okay, I need to get this treated. First thing to know, a scar is never just a scar. They come in all different forms. You've got the ones that are raised and thick. Those are called hypertrophic scars, or in more extreme cases, keloids. Then you have the total opposite, the depressed or pitted kind, which doctors call atrophic scars. A great example of this is the kind of scarring left by severe acne. And in really serious cases, like after a bad burn, you can get something called a contracture, which is a tight band of scar tissue that can literally stop you from moving properly. And as you can imagine, each one of these needs a completely different game plan. So have you ever wondered why two people can get almost the same injury, but end up with wildly different scars? Well, it really boils down to a battle between your genetics and, believe it or not, physics. Your DNA can actually predispose you to things like keloids, where your body just goes into collagen-making overdrive. But the other huge piece of the puzzle is physical tension. I mean, think about a wound on your knee or your shoulder. Every single time you move, you're pulling that wound apart. That constant stretching is what can lead to a wider, much more noticeable scar. And now we've arrived at what is, without a doubt, the single most important part of this whole discussion. It is all about setting the right expectations. Understanding this next point is absolutely crucial before anyone even thinks about scar revision. And this says it all. This is the core truth of scar revision. I'm going to repeat it because it's just that important. The goal is improvement, not erasure. It is physically impossible to completely remove a scar. The entire process is about replacing an old, problematic scar with a new, better healed, and way less conspicuous one. All right, so if we can't just erase it, how do we actually achieve this improvement? Well, it's not a one-size-fits-all solution. A much better way to think about it is like a toolkit. A skilled professional is going to look at your specific scar and choose the exact right tools for that specific job. Broadly speaking, those tools fall into two main categories. On one hand, you've got your non-surgical options. These work on the surface of the skin to improve things like the color and texture. Then, on the other hand, you have the surgical path. This is all about physically removing the old scar tissue and essentially starting over, but under much more controlled, ideal conditions. Let's open up that non-surgical toolkit first. For fairly new scars, silicone sheets are a fantastic go-to. They help hydrate the tissue and encourage it to heal better. Now, if you're dealing with a really tough, raised keloid scar, a doctor might use very targeted steroid injections to help flatten and soften it from the inside. And for other issues like redness or an uneven texture, lasers can be used to precisely resurface the skin. It's pretty amazing stuff. Now, let's talk about the most common surgical approach. It's called excision and reclosure. It sounds really straightforward, right? Cut out the old scar and stitch it back up. But the real magic is in the details. A surgeon will remove the old scar and then meticulously reclose the skin in layers, making absolutely sure there's no tension on that wound. This gives the new scar the best possible chance to heal as a very fine, thin line. Okay, this is where surgery gets really, really clever. For scars that are in tricky spots, like right across a joint, a straight line is always going to pull tight whenever you move. So surgeons use these incredible techniques like a Z-plasty. By cutting and repositioning these tiny little triangular flaps of skin, they can actually break up that straight line, reorienting the scar so it aligns with your natural skin creases. This releases all that tension and makes the scar far less noticeable and restrictive. But what about those depressed, indented scars we talked about? For those, there's a technique called subcision. A special needle is inserted right under the skin to snip the little fibrous bands that are tethering the scar down to the deeper tissue. Once those are released, the surface of the skin can lift back up to a much more even level. So the procedure is done, but that is definitely not the end of the story. The recovery and the healing journey that follows is just as critical as the procedure itself. Of course, any procedure has potential risks. There are common temporary things like swelling, bruising, and some redness. But there are also less common, more serious risks, like an infection, changes in your skin color, or even the scar coming back, which is a known challenge, especially with keloids. This is exactly why following those aftercare instructions to the letter is so critical. It's the best way to minimize these risks. And you have to remember, healing takes time. This timeline is so important for managing expectations. For the first month or so, your main job is just to protect the area from any tension. But the real maturation of the scar happens over many months. The redness will slowly start to fade, and the scar will continue to soften and settle for up to a year, maybe even longer. So yes, patience is absolutely essential. Okay, let's fast forward. It's been a year, maybe even more. You've been patient, you've followed all the aftercare instructions. So what does a successful outcome actually look like at this point? Success means that the new scar is a huge improvement over the old one. It's thinner, it's flatter, and its color has blended much better with the skin around it. And if it was causing any tightness before, that restriction is now gone. So here's the crucial point. It's not invisible, but it is no longer the first thing you notice. And that brings us right back to where we started. Understanding that the goal is meaningful improvement, not impossible perfection, is truly everything. This is a journey that takes professional expertise, a lot of patience, and truly realistic expectations. So the only question left to answer is, does that journey align with what you're looking for?